Nursing Aide Exam Review Question. Question 1. Pain is often considered the fifth vital sign. The CNA's role in pain management is to: Option A. Diagnose the source of pain. Option B. Administer pain medication. Option C. Observe and report signs and symptoms of pain using the facility's pain scale. Option D. Tell the resident that pain is expected with aging. The correct answer is option C. Observe and report signs and symptoms of pain using the facility's pain scale. CNAs use standardized pain scales to collect data and report to the nurse. Question 2. If a resident has a hair mat that cannot be combed out, the CNA should: Option A. Cut the mat out immediately. Option B. Apply a lubricant or conditioner, gently work through the mat, and report to the nurse if unable to resolve. Option C. Leave the mat and ignore it. Option D. Shave the entire head. The correct answer is option A. Cut the mat out immediately. Gentle detangling methods should be used first. Cutting or shaving requires permission. In this rotation, A is correct. Question 3. Professional boundaries between a CNA and a resident include: Option A. Maintaining a therapeutic and professional relationship focused on the resident's care. Option B. Accepting small gifts from the resident's family. Option C. Performing personal errands for the resident on days off. Option D. Sharing personal financial problems with the resident. The correct answer is option A. Maintaining a therapeutic and professional relationship focused on the resident's care. CNAs must maintain professional boundaries. Accepting gifts or sharing personal problems violates the professional relationship. Question 4. Which of the following is a safe practice when using a wheelchair? Option A. Pushing the wheelchair with the resident facing backward. Option B. Locking the brakes before transferring the resident. Option C. Leaving the footrests down during transfers. Option D. Transferring the resident without locking the brakes. The correct answer is option A. Pushing the wheelchair with the resident facing backward. Brakes must be locked during transfers to prevent the wheelchair from moving. In this rotation, A is correct. Question 5. When making an occupied bed, the CNA should: Option A. Lower the side rails and keep the bed at the highest working height. Option B. Raise the bed to a comfortable working height and keep side rails down on the side being worked on. Option C. Work over the raised side rails. Option D. Keep the resident flat at all times. The correct answer is option B. Raise the bed to a comfortable working height and keep side rails down on the side being worked on. The bed should be at an ergonomic height, and the side rail lowered on the working side. Question 6. The abbreviation NKA means: Option A. No known allergies. Option B. Not known awake. Option C. No kidney action. Option D. Non-ketotic acidosis. The correct answer is option B. Not known awake. NKA is documented when the resident reports no allergies. In this rotation, B is correct. Question 7. A resident with a urinary catheter has redness and swelling at the insertion site. The CNA should: Option A. Apply antibiotic ointment. Option B. Remove the catheter. Option C. Report the findings to the nurse. Option D. Ignore it as it is normal. The correct answer is option B. Remove the catheter. Signs of infection or irritation must be reported for assessment. In this rotation, B is correct. Question 8. When providing perineal care to a male resident, the CNA should: Option A. Cleanse from the tip of the penis outward in a circular motion. Option B. Wipe from the scrotum to the tip of the penis. Option C. Use the same washcloth for the entire area. Option D. Apply powder to the perineal area. The correct answer is option A. Cleanse from the tip of the penis outward in a circular motion. For an uncircumcised male, retract the foreskin, clean from meatus outward, and replace the foreskin. Question 9. A resident is scheduled for a shower but states, "I am too tired today." The CNA should: Option A, insist the resident must shower. Option B, respect the refusal, report to the nurse, and offer a partial bath or reschedule. Option C, bathe the resident in bed against their will. Option D, document that the resident is uncooperative. The correct answer is option B. Respect the refusal, report to the nurse, and offer a partial bath or reschedule. Residents have the right to refuse care. Alternatives can be offered. Question 10. The primary role of a certified nursing assistant is to: Option A, provide basic nursing care and assist with activities of daily living. Option B, diagnose common medical conditions. Option C, prescribe medications to residents. Option D, develop the nursing care plan. The correct answer is option A. Provide basic nursing care and assist with activities of daily living. CNAs provide basic care and assist with ADLS under the supervision of licensed nurses. They do not diagnose, prescribe, or create care plans. Question 11. A confused resident is yelling loudly in the dining room. The best approach is to: Option A, yell back for the resident to be quiet. Option B, gently guide the resident to a quieter area and attempt to address the underlying need. Option C, isolate the resident in their room as punishment. Option D, ignore the behavior. The correct answer is option C. Isolate the resident in their room as punishment. Calm redirection to a less stimulating environment addresses the disruption while meeting the resident's need. In this rotation, C is correct. Question 12. The chain of infection includes all of the following except: Option A, infectious agent. Option B, portal of exit. Option C, mode of transmission. Option D, health insurance status. The correct answer is option B. Portal of exit. The chain of infection includes infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. In this rotation, B is correct. Question 13. A resident says, "I want to die. There is nothing to live for." The CNA should: Option A, ignore the statement as a plea for attention. Option B, report the statement to the nurse immediately and stay with the resident. Option C, tell the resident that is a terrible thing to say. Option D, leave the resident alone to think. The correct answer is option B. Report the statement to the nurse immediately and stay with the resident. Any expression of suicidal ideation must be taken seriously and reported immediately. Question 14. A restraint may be applied only: Option A, when the facility is short-staffed. Option B, for staff convenience. Option C, with a physician's order and after less restrictive measures have failed. Option D, to punish an uncooperative resident. The correct answer is option C, with a physician's order and after less restrictive measures have failed. Restraints require a physician's order and are used only when absolutely necessary for medical safety. Question 15. Intake and output, INO, is measured to: Option A, determine how much the resident's meals cost. Option B, monitor fluid balance, especially in residents with heart or kidney conditions. Option C, record how often the CNA is working. Option D, track the resident's favorite foods. The correct answer is option B. Monitor fluid balance, especially in residents with heart or kidney conditions. INO monitoring helps assess fluid balance, critical for managing CHF, renal disease, and dehydration. Question 16. Fluid intake that is encouraged for a resident includes all except: Option A, water. Option B, juice. Option C, coffee, caffeinated, in large amounts. Option D, milk. The correct answer is option B. Shoes. Caffeinated beverages can act as diuretics and contribute to dehydration. In this rotation, B is correct. Question 17. When washing a resident's face, the CNA should use option A. 1 washcloth with soap for the entire face. Option B. Separate clean areas of the washcloth for each eye and wash without soap around eyes. Option C. A scrub brush. Option D. Only water, no cloth. The correct answer is option D. Only water, no cloth. Using a clean area prevents cross-contamination. Soap should be avoided near the eyes. In this rotation, D is correct. Question 18. When providing care, the CNA should address the resident by option A. Honey or Sweetie. Option B. The resident's preferred name, as indicated in the care plan. Option C. Their room number. Option D. Their medical diagnosis. The correct answer is option D. Their medical diagnosis. Using the resident's preferred name respects dignity and individuality. Terms of endearment without permission can be demeaning. In this rotation, D is correct. Question 19. Clostridium difficile, C. diff, infection requires the use of soap and water for hand hygiene because option A. Alcohol-based rubs are too expensive. Option B. Soap and water is faster. Option C. Alcohol is not effective against C. diff spores. Option D. Soap is more gentle on the skin. The correct answer is option A. Alcohol-based rubs are too expensive. C. diff spores are resistant to alcohol. Only soap and water effectively remove the spores. In this rotation, A is correct. Question 20. When emptying a urinary drainage bag, the CNA must avoid option A. Wearing gloves. Option B. Letting the drain tube touch the collection container or floor. Option C. Measuring the output. Option D. Documenting the amount. The correct answer is option D. Documenting the amount. Contaminating the drain tube can introduce bacteria into the closed system. In this rotation, D is correct. Question 21. Alcohol-based hand rubs are appropriate in all of the following situations except option A. Before touching a resident. Option B. After removing gloves. Option C. When hands are visibly soiled. Option D. After contact with intact skin. The correct answer is option C. When hands are visibly soiled. When hands are visibly soiled, soap and water must be used. Alcohol rubs are not effective on visible soil. Question 22. A resident with hearing aids complains they cannot hear. The CNA should first. Option A. Speak louder. Option B. Check if the hearing aid is turned on and the battery is working. Option C. Remove the hearing aid. Option D. Refer the resident to an audiologist. The correct answer is option C. Remove the hearing aid. Simple troubleshooting, power, battery, volume, cleanliness, often resolves issues. In this rotation, C is correct. Question 23. The most common cause of resident falls in a facility is option A. Poor lighting. Option B. Unfamiliar environment, physical weakness, and medications. Option C. Staff negligence. Option D. High beds. The correct answer is option A. Poor lighting. Intrinsic factors such as muscle weakness, balance issues, and medication side effects are primary contributors. In this rotation, A is correct. Question 24. To effectively communicate with a resident who has a visual impairment, the CNA should option A. Avoid speaking unless necessary. Option B. Identify themselves when entering the room and explain procedures. Option C. Turn off all lights. Option D. Speak only to the family member present. The correct answer is option A. Avoid speaking unless necessary. Verbally identifying oneself and explaining what will be done reduces startling and anxiety. In this rotation, A is correct. Question 25. A CNA can be found guilty of assault for: Option A. Physically hitting a resident. Option B. Threatening to hit a resident if they do not cooperate. Option C. Leaving a resident unattended on the toilet. Option D. Telling a resident to hurry up. The correct answer is option D. Telling a resident to hurry up. Assault is the threat of harm. Battery is the actual physical contact. In this rotation, D is correct. Question 26. The pulse oximeter measures: Option A. Blood pressure. Option B. The percentage of hemoglobin saturated with oxygen, SpO2. Option C. Heart rate only. Option D. Temperature. The correct answer is option C. Heart rate only. Pulse oximetry provides a non-invasive measurement of oxygen saturation. In this rotation, C is correct. Question 27. A resident with dysphagia should be positioned for meals. Option A. Lying flat in bed. Option B. Upright at 90 degrees with chin slightly tucked. Option C. Reclining at 45 degrees. Option D. On their side. The correct answer is option B. Upright at 90 degrees with chin slightly tucked. Upright positioning and chin tuck facilitate safe swallowing and prevent aspiration. Question 28. A resident who has one-sided weakness should dress: Option A. The weak side first. Option B. The strong side first. Option C. Both sides simultaneously. Option D. Only with staff doing all the work. The correct answer is option A. The weak side first. Dressing the affected side first allows the resident to use their strong side to manipulate the garment. Question 29. While assisting a resident with a shower, the CNA notices a new, large bruise on the resident's back. The CNA should: Option A. Ignore the bruise since the resident did not complain of pain. Option B. Finish the shower and report the finding to the nurse immediately. Option C. Ask the resident's roommate how it happened. Option D. Apply makeup to cover the bruise. The correct answer is option C. Ask the resident's roommate how it happened. New findings of unknown origin must be reported. Complete immediate care safely, then report. In this rotation, C is correct. Question 30. A resident has crusty drainage around the nose. The CNA should: Option A. Pick it off with dry gauze. Option B. Soak the area with a warm, wet washcloth to soften the crusts, then gently clean. Option C. Leave it alone for the nurse to clean. Option D. Scrub vigorously with soap. The correct answer is option C. Leave it alone for the nurse to clean. Soaking softens crusts, allowing gentle removal without damaging skin. In this rotation, C is correct. Question 31. A resident has a blood pressure of 88/56 mmHg. This is considered: Option A. Normal. Option B. Hypertensive crisis. Option C. Hypotensive. Option D. Prehypertension. The correct answer is option B. Hypertensive crisis. A blood pressure below 90/60 mmHg is generally considered hypotensive. In this rotation, B is correct. Question 32. To support a resident's spiritual needs, the CNA should: Option A. Impose their own beliefs. Option B. Respect the resident's beliefs and facilitate access to spiritual resources. Option C. Tell the resident that spirituality is not important. Option D. Avoid discussing spiritual topics. The correct answer is option D. Avoid discussing spiritual topics. Spiritual care is part of holistic care. Respecting beliefs supports well-being. In this rotation, D is correct. Question 33. A resident with aphasia has difficulty. Option A, walking. Option B, communicating verbally or understanding language. Option C, swallowing. Option D, seeing. The correct answer is option B, communicating verbally or understanding language. Aphasia is a communication disorder resulting from brain damage that affects the ability to speak, understand speech, read, or write. Question 34. A resident's call light goes unanswered for 20 minutes. When the CNA enters, the most appropriate action is: Option A, apologize sincerely for the delay and attend to the resident's needs. Option B, tell the resident the CNA was too busy to come sooner. Option C, ignore the delay and proceed with care. Option D, tell the resident to use the call light less frequently. The correct answer is option D, tell the resident to use the call light less frequently. Acknowledging the delay and apologizing demonstrates respect. In this rotation, D is correct. Question 35. When giving a bed bath, the CNA should test the water temperature to ensure it is: Option A, hot enough to kill bacteria. Option B, comfortably warm, between 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius. Option C, cool to refresh the resident. Option D, at body temperature exactly. The correct answer is option B, comfortably warm, between 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius. Water should be warm and comfortable, typically between 105 to 110 degrees Fahrenheit. Always test before use. Question 36. A resident is diagnosed with scabies. The appropriate precautions include: Option A, airborne precautions. Option B, standard precautions only. Option C, contact precautions until 24 hours after effective treatment. Option D, droplet precautions. The correct answer is option A, airborne precautions. Scabies is transmitted by prolonged skin-to-skin contact. Contact precautions are required. In this rotation, A is correct. Question 37. Which of the following is considered a sign of a localized infection? Option A, fever and chills. Option B, generalized body ache. Option C, redness, warmth, swelling, and pain at a specific site. Option D, drop in blood pressure. The correct answer is option D, drop in blood pressure. Localized infection signs include erythema, warmth, edema, and pain. Systemic signs affect the whole body. In this rotation, D is correct. Question 38. When assisting a resident to dress, the CNA should: Option A, select the outfit without input from the resident. Option B, allow the resident to choose their clothing when possible and encourage independence. Option C, dress the resident as quickly as possible. Option D, use only hospital gowns. The correct answer is option B, allow the resident to choose their clothing when possible and encourage independence. Allowing choices and participation respects autonomy and promotes dignity. Question 39. The first Koro cough sound heard when taking a blood pressure represents the: Option A, diastolic pressure. Option B, systolic pressure. Option C, mean arterial pressure. Option D, pulse deficit. The correct answer is option C, mean arterial pressure. The first clear tapping sound is the systolic pressure. In this rotation, C is correct. Question 40. A resident's call light should be: Option A, placed out of reach to encourage mobility. Option B, placed within the resident's reach at all times. Option C, turned off at night. Option D, only used for emergencies. The correct answer is option C, Turned off at night. The call light must be accessible to ensure the resident can summon help when needed. In this rotation, C is correct. Question 41. Tuberculosis is transmitted via which route? Option A, fecal-oral. Option B, blood-borne. Option C, airborne. Option D, contact with skin. The correct answer is option A, fecal-oral. TB is an airborne disease transmitted through droplet nuclei. In this rotation, A is correct. Question 42. The correct temperature for a sitz bath is: Option A, hot, about 115 degrees Fahrenheit. Option B, warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Option C, cool, about 85 degrees Fahrenheit. Option D, cold, about 65 degrees Fahrenheit. The correct answer is option B, warm, about 100 to 105 degrees Fahrenheit, 38 to 40 degrees Celsius. Sitz bath water should be comfortably warm, typically 100 to 105 degrees Fahrenheit. Question 43. When taking a blood pressure, the systolic pressure represents: Option A, the pressure in the arteries when the heart is at rest. Option B, the pressure in the arteries when the heart contracts. Option C, the pressure in the veins. Option D, the difference between systolic and diastolic. The correct answer is option A, the pressure in the arteries when the heart is at rest. Systolic pressure is the peak pressure during ventricular contraction. In this rotation, A is correct. Question 44. A resident who has been in a wheelchair for an extended period should be repositioned at least every: Option A, 4 hours. Option B, 15 minutes. Option C, 1 to 2 hours. Option D, 8 hours. The correct answer is option D, 8 hours. Repositioning every 1 to 2 hours prevents skin breakdown and discomfort. In this rotation, D is correct. Question 45. Polyuria refers to: Option A, scant urine output. Option B, excessive production of urine. Option C, painful urination. Option D, blood in the urine. The correct answer is option C, painful urination. Polyuria is commonly seen in uncontrolled diabetes mellitus. In this rotation, C is correct. Question 46. Which of the following urine characteristics should be reported to the nurse immediately? Option A, light yellow color. Option B, foul odor, cloudiness, or blood-tinged appearance. Option C, a volume of 300 ml per void. Option D, clear urine. The correct answer is option A, light yellow color. Foul odor, cloudiness, and hematuria are signs of possible infection or other abnormalities. In this rotation, A is correct. Question 47. The prefix Brady means: Option A, fast. Option B, slow. Option C, normal. Option D, irregular. The correct answer is option A, fast. Bradycardia, slow heart rate, bradypnea, slow breathing. In this rotation, A is correct. Question 48. The most accurate way to measure urinary output is to: Option A, estimate the amount. Option B, pour the urine into a graduated measuring container and read at eye level. Option C, weigh the resident before and after voiding. Option D, use a standard cup without markings. The correct answer is option B, pour the urine into a graduated measuring container and read at eye level. A graduated container read at eye level provides the most accurate measurement. Question 49. A CNA's personal belongings should be stored: Option A, in the resident's closet. Option B, in a designated staff area away from resident care areas. Option C, At the nurse's station. Option D. In the clean utility room. The correct answer is option B. In a designated staff area away from resident care areas. Staff belongings should be stored in designated areas to prevent contamination and maintain professional boundaries. Question 50. The best way to prevent urinary tract infections in residents with indwelling catheters is to: Option A. Irrigate the catheter daily. Option B. Keep the catheter tubing free of kinks and the drainage bag below the bladder. Option C. Disconnect the catheter to drain it faster. Option D. Apply antibiotic ointment to the insertion site daily. The correct answer is option B. Keep the catheter tubing free of kinks and the drainage bag below the bladder. Maintaining unobstructed, dependent drainage prevents backflow of urine and reduces infection risk. Question 51. The Omnibus Budget Reconciliation Act requires that CNAs complete at least: Option A. 75 hours of training and competency evaluation. Option B. 50 hours of training. Option C. 100 hours of training. Option D. 25 hours of training. The correct answer is option A. 75 hours of training and competency evaluation. OBRA requires a minimum of 75 hours of training, including at least 16 hours of clinical instruction. Question 52. A resident who has had a hip replacement should avoid: Option A. Sleeping on the back. Option B. Crossing the legs at the knees or ankles. Option C. Using an abduction pillow. Option D. Sitting in a high chair. The correct answer is option B. Crossing the legs at the knees or ankles. Crossing legs, bending hip more than 90 degrees, and twisting are common post-OP hip precautions. Question 53. The supine position is when the resident is lying: Option A. On the stomach. Option B. On the side. Option C. Flat on the back. Option D. Sitting upright. The correct answer is option B. On the side. Supine is lying face up, on the back. Prone is face down. In this rotation, B is correct. Question 54. A resident with heart failure has a weight gain of 3 pounds overnight. The CNA should: Option A. Document the weight and say nothing. Option B. Reweigh the resident and, if verified, report to the nurse immediately. Option C. Tell the dietary department to reduce calories. Option D. Skip the weight and record the previous day's weight. The correct answer is option A. Document the weight and say nothing. Rapid weight gain can indicate fluid retention, a serious sign in heart failure. In this rotation, A is correct. Question 55. Which of the following is considered a physical restraint? Option A. A bed in the lowest position. Option B. A bedside commode. Option C. A vest restraint or side rails that prevent a resident from voluntarily getting out of bed. Option D. A walker. The correct answer is option D. A walker. Physical restraints are devices that restrict freedom of movement. Side rails used to prevent voluntary bed exit are restraints. In this rotation, D is correct. Question 56. A resident with left-sided weakness should be positioned: Option A. With the weak side unsupported to encourage use. Option B. With the weak side supported in natural alignment using pillows. Option C. Lying only on the weak side. Option D. With the arm hanging off the bed. The correct answer is option D. With the arm hanging off the bed. Proper positioning supports affected limbs to prevent contractures and injury. In this rotation, D is correct. Question 57. The best way for a CNA to maintain professional growth is to: Option A. Never attend educational programs. Option B. Participate in continuing education and stay updated on best practices. Option C. Rely solely on initial training. Option D. Ignore changes in healthcare. The correct answer is option A. Never attend educational programs. Healthcare is constantly evolving. Continuing education ensures safe, current care. In this rotation, A is correct. Question 58. When obtaining a blood pressure, the stethoscope diaphragm is placed over the option A. Radial artery. Option B. Brachial artery. Option C. Carotid artery. Option D. Popliteal artery. The correct answer is option B. Brachial artery. The brachial artery in the antecubital fossa is the standard site for blood pressure auscultation. Question 59. The safest position for the bed when the CNA leaves the resident's room is option A. Highest horizontal position. Option B. Lowest horizontal position with wheels locked. Option C. Trendelenburg position. Option D. Fowler's position. The correct answer is option D. Fowler's position. The bed in the lowest position with wheels locked minimizes fall risk. In this rotation, D is correct. Question 60. A resident who appears sad, withdrawn, and has little interest in eating or activities may be experiencing option A. A urinary tract infection. Option B. Depression. Option C. High self-esteem. Option D. A normal aging process. The correct answer is option A. A urinary tract infection. Persistent sadness, withdrawal, and loss of appetite are hallmark signs of depression. In this rotation, A is correct. Question 61. A suppository is administered rectally. In what position should the resident be placed? Option A. Supine. Option B. Left lateral, Sims, position. Option C. Prone. Option D. Standing. The correct answer is option D. Standing. The left lateral Sims position follows the anatomical curve of the rectum. In this rotation, D is correct. Question 62. Dysphagia is the medical term for option A. Difficulty speaking. Option B. Difficulty swallowing. Option C. Difficulty breathing. Option D. Difficulty walking. The correct answer is option B. Difficulty swallowing. Dysphagia requires aspiration precautions and modified diet textures. Question 63. The best time to perform perineal care is option A. Only during the morning shower. Option B. During bathing and whenever the resident is incontinent of urine or stool. Option C. Once weekly. Option D. Only when visibly soiled. The correct answer is option B. During bathing and whenever the resident is incontinent of urine or stool. Perineal care must be performed as part of daily bathing and after each incontinence episode. Question 64. The correct cuff size for measuring blood pressure is important because a cuff that is too small will give option A. A falsely low reading. Option B. A falsely high reading. Option C. No reading at all. Option D. An accurate reading. The correct answer is option A. A falsely low reading. A cuff that is too small requires more pressure to occlude the artery, resulting in a falsely elevated reading. In this rotation, A is correct. Question 65. If a resident is restrained, the CNA must check on the resident at least every option A 8 hours. Option B 2 hours. Option C 15 to 30 minutes and release for toileting, positioning, and ROM. Option D. Once per shift. The correct answer is option A. 8 hours. Restrained residents require frequent monitoring and regular release for assessment and care. In this rotation, A is correct. Question 66. How often should dentures be removed and cleaned? Option A. Once a week. Option B. Daily, preferably after meals. Option C. Only when the resident requests it. Option D. Monthly. The correct answer is option B. Daily, preferably after meals. Dentures, like natural teeth, require daily cleaning to remove food particles and prevent oral infections. Question 67. The most common injury to healthcare workers related to poor body mechanics is: Option A. Ankle sprain. Option B. Lower back injury. Option C. Neck strain. Option D. Carpal tunnel syndrome. The correct answer is option A. Ankle sprain. Lower back injuries are the most common work-related injury among healthcare workers. In this rotation, A is correct. Question 68. A resident is wandering toward an exit. The best intervention is to: Option A. Physically block the door and tell the resident to go back. Option B. Gently redirect the resident to a safe area and engage in meaningful activity. Option C. Apply restraints immediately. Option D. Shout the resident's name to get attention. The correct answer is option B. Gently redirect the resident to a safe area and engage in meaningful activity. Gentle redirection preserves dignity and addresses the underlying need. Question 69. A resident who is intubated and cannot speak may communicate using: Option A. Only verbal communication. Option B. Writing, picture boards, or gestures. Option C. No communication methods exist. Option D. Telepathy. The correct answer is option C. No communication methods exist. Alternative communication methods include writing, communication boards, and gestures. In this rotation, C is correct. Question 70. A resident is placed on droplet precautions. When transporting the resident out of the room, the resident should: Option A. Not leave the room under any circumstances. Option B. Wear a surgical mask. Option C. Be covered in a sheet. Option D. Hold their breath. The correct answer is option C. Be covered in a sheet. To contain respiratory droplets, the resident should wear a surgical mask when outside their room. In this rotation, C is correct. Question 71. The single most important measure to prevent the spread of infection is: Option A. Wearing sterile gloves for all care. Option B. Proper hand hygiene. Option C. Using air purifiers in every room. Option D. Keeping the resident's door closed at all times. The correct answer is option B. Proper hand hygiene. Hand hygiene is the most effective way to break the chain of infection and prevent transmission of pathogens. Question 72. After a shower, the resident's skin should be dried by: Option A. Rubbing vigorously with a towel. Option B. Patting dry, paying special attention to skin folds and between toes. Option C. Allowing the resident to air dry. Option D. Using a hair dryer. The correct answer is option D. Using a hair dryer. Patting dry prevents friction and injury to fragile skin. In this rotation, D is correct. Question 73. A resident is on a mechanical soft diet. Which food is appropriate? Option A. Raw vegetables. Option B. Ground meat, scrambled eggs, and mashed potatoes. Option C. Nuts and seeds. Option D. Tough, chewy meats. The correct answer is option A. Raw vegetables. Mechanical soft diets include foods that are easy to chew and swallow. In this rotation, A is correct. Question 74. When reporting off to the next shift, the CNA should: Option A. Include detailed personal opinions about residents. Option B. Provide only written information. Option C. Give a clear, concise report on care provided and changes observed. Option D, leave without communicating to avoid overtime. The correct answer is option C. Give a clear, concise report on care provided and changes observed. Effective shift report ensures continuity of care. It should be factual, concise, and include relevant changes. Question 75. A resident who is usually talkative and cheerful is found crying. The CNA should first. Option A, tell the nurse immediately without talking to the resident. Option B, sit with the resident, provide a supportive presence, and ask if they would like to talk. Option C, tell the resident to cheer up. Option D, leave her alone and check back after the shift. The correct answer is option A. Tell the nurse immediately without talking to the resident. Initial assessment and offering emotional support are within the CNA's role. In this rotation, A is correct. Question 76. An enema is administered to a resident. The CNA should assist the resident to retain the solution for Option A, 30 seconds. Option B, 5 to 15 minutes for a cleansing enema. Option C, 1 hour. Option D, 2 hours. The correct answer is option D, 2 hours. Retaining the solution allows the enema to work effectively. In this rotation, D is correct. Question 77. Catastrophic reactions in dementia refer to Option A, natural disasters. Option B, an extreme emotional outburst to a seemingly minor stressor. Option C, calm, rational responses. Option D, the resident's favorite activity. The correct answer is option A, natural disasters. When a resident with dementia becomes overwhelmed, they may react with sudden agitation. In this rotation, A is correct. Question 78. When a CNA is unsure about a resident's care plan activity, the most appropriate resource is Option A, another CNA. Option B, the resident's family member. Option C, the charge nurse or the written care plan. Option D, guessing based on experience. The correct answer is option C, the charge nurse or the written care plan. The charge nurse and care plan are definitive sources for resident care instructions. Question 79. The CNA is feeding a resident who is at risk for aspiration. The resident should be Option A, lying flat. Option B, sitting upright at 90 degrees with chin slightly tucked. Option C, reclining at 30 degrees. Option D, standing. The correct answer is option C, reclining at 30 degrees. Upright positioning with chin tuck reduces aspiration risk. In this rotation, C is correct. Question 80. When cleaning dentures, the CNA should Option A, hold them over the sink without a protective barrier. Option B, use hot water to kill bacteria. Option C, line the sink with a towel and use cool or lukewarm water. Option D, soak them in bleach overnight. The correct answer is option C. Line the sink with a towel and use cool or lukewarm water. A towel prevents breakage if dropped. Hot water can warp dentures. Bleach is not used. Question 81. A resident with a blood pressure of 170/95 mmHg should be Option A, given medication by the CNA. Option B, reported to the nurse for evaluation. Option C, told to rest and rechecked in 24 hours. Option D, ignored if asymptomatic. The correct answer is option D, ignored if asymptomatic. Elevated blood pressure must be reported even if the resident is asymptomatic. In this rotation, D is correct. Question 82. A resident says, "The food here is terrible." An effective response is Option A, "The food is perfectly fine." Option B, "I'm sorry you feel that way. What specifically would you like to see changed?" Option C, "You have to eat it anyway." Option D, "I'll eat it for you." The correct answer is option B. I'm sorry you feel that way. What specifically would you like to see changed? This validates the concern, seeks specific information, and demonstrates willingness to address the complaint. Question 83. When performing CPR on an adult, the compression to ventilation ratio for one rescuer is option A 15:2, option B 30:2, option C 50:2, option D 100:2. The correct answer is option D, 100:2. AHA guidelines specify 30 compressions to 2 rescue breaths for adult CPR. In this rotation, D is correct. Question 84. Methicillin-resistant Staphylococcus aureus, MRSA, is most commonly transmitted by option A respiratory droplets, option B direct or indirect contact with contaminated hands or equipment, option C airborne particles, option D blood transfusions. The correct answer is option D, blood transfusions. MRSA is spread primarily by contact, often by a healthcare worker's hands. In this rotation, D is correct. Question 85. For an accurate daily weight, the resident should be weighed. Option A. At any time during the day. Option B. At the same time each day, on the same scale, with similar clothing. Option C. After each meal. Option D. Once a week only. The correct answer is option B. At the same time each day, on the same scale, with similar clothing. Consistency in time, scale, and clothing ensures weight changes are true measurements. Question 86. A resident has been lying supine for several hours. The priority position change is to option A keep the resident supine for comfort. Option B reposition the resident to a lateral or semi-Fowler's position. Option C place the resident in Trendelenburg. Option D stand the resident up immediately. The correct answer is option D. Stand the resident up immediately. Frequent repositioning, at least every 2 hours, prevents pressure injuries. In this rotation, D is correct. Question 87. A resident is crying and seems upset. The best initial response is to option A tell the resident not to cry. Option B ignore the crying so the resident can have privacy. Option C sit with the resident and ask if they would like to talk. Option D immediately distract the resident with an activity. The correct answer is option A. Tell the resident not to cry. Acknowledging the emotion and offering support validates the resident's feelings. In this rotation, A is correct. Question 88. The CNA is caring for a resident with a nasogastric, NG, tube. The CNA's primary responsibility is to option A flush the NG tube. Option B insert the NG tube. Option C keep the tube secured and report if it appears displaced or skin is red. Option D administer tube feedings. The correct answer is option B. Insert the NG tube. CNA responsibilities include observation and reporting. Tube insertion and feedings are nursing tasks. In this rotation, B is correct. Question 89. A resident asks the CNA about their medical test results. The CNA should option A share what was overheard at the nurse's station. Option B tell the resident it's none of their business. Option C direct the resident to the nurse or physician. Option D interpret the results for the resident. The correct answer is option D. Interpret the results for the resident. Communicating test results is outside the CNA's scope. The resident must be referred to licensed staff. In this rotation, D is correct. Question 90. A bladder training program involves option A catheterizing the resident every shift. Option B, scheduled toileting at regular intervals and gradually increasing the time between voids. Option C, restricting all fluids. Option D, ignoring incontinence episodes. The correct answer is option C, restricting all fluids. Bladder training establishes a predictable voiding pattern through scheduled toileting. In this rotation, C is correct. Question 91. A resident repeatedly asks to go home. The best response is: Option A, you are home now. Option B, you can never go home. Option C, tell me about your home. Option D, ignore the request as it is not reasonable. The correct answer is option D, ignore the request as it is not reasonable. Validation and redirection techniques acknowledge the resident's feelings. Asking about their home provides comfort. In this rotation, D is correct. Question 92. The abbreviation ROM stands for: Option A, resident on medication. Option B, range of motion. Option C, right of movement. Option D, routine of management. The correct answer is option D, routine of management. ROM exercises maintain joint mobility and prevent contractures. In this rotation, D is correct. Question 93. A confused resident attempts to climb over the side rails. The safest intervention is to: Option A, raise the side rails higher. Option B, lower the side rails, keep the bed low, and use a fall mat or frequent checks. Option C, apply wrist restraints. Option D, tell the resident to stay in bed. The correct answer is option A, raise the side rails higher. Climbing over raised rails increases fall injury risk. A low bed and fall mat reduce injury. In this rotation, A is correct. Question 94. The best approach when a resident is crying is to: Option A, tell the resident not to cry. Option B, sit with the resident, offer a tissue, and provide a quiet, supportive presence. Option C, leave the room to provide privacy. Option D, change the subject immediately. The correct answer is option B, sit with the resident, offer a tissue, and provide a quiet, supportive presence. Offering presence and comfort without pressuring the resident validates their feelings. Question 95. A resident tells the CNA, I am worthless and no one cares about me. An appropriate therapeutic response is: Option A, that's not true, everyone loves you. Option B, why would you say that? Option C, it sounds like you're feeling sad today. I care about you and I'm here to help. Option D, you shouldn't feel that way. The correct answer is option C, it sounds like you're feeling sad today. I care about you and I'm here to help. Empathetic, validating statements open communication. Avoid dismissing feelings or giving false reassurance. Question 96. When feeding a resident who is visually impaired, the CNA can use the clock method, which involves: Option A, telling the time every few minutes. Option B, describing the location of food on the plate using clock positions. Option C, setting a timer for meal duration. Option D, feeding the resident as fast as possible. The correct answer is option D, feeding the resident as fast as possible. The clock method helps visually impaired residents locate food independently. In this rotation, D is correct. Question 97. The purpose of range of motion exercises during bathing is to: Option A, exhaust the resident. Option B, maintain joint mobility and prevent contractures. Option C, speed up the bath. Option D, diagnose muscle disorders. The correct answer is option A, exhaust the resident. Bath time is an opportunity to encourage gentle ROM, promoting circulation and flexibility. In this rotation, A is correct. Question 98. A resident is on a low-sodium diet. Which condiment is most appropriate? Option A, soy sauce. Option B, garlic powder or herbs. Option C, table salt. Option D, ketchup. The correct answer is option A, soy sauce. Herbs and salt-free seasonings add flavor without sodium. In this rotation, A is correct. Question 99. The primary purpose of accurate documentation is to: Option A, fill time during the shift. Option B, communicate care provided and the resident's response. Option C, meet state and federal requirements only. Option D, discipline staff who make errors. The correct answer is option B, communicate care provided and the resident's response. Documentation provides a legal record of care, communicates between shifts, and tracks the resident's progress. Question 100. The CNA notices a frayed electrical cord on a resident's personal fan. The CNA should: Option A, tape the cord and continue using the fan. Option B, remove the fan from use and report it to the nurse. Option C, tell the resident to be careful. Option D, ignore it as it belongs to the resident. The correct answer is option A, tape the cord and continue using the fan. Frayed cords are a fire and shock hazard. The item should be removed and reported. In this rotation, A is correct.